Hi, everybody. This is chapter 31 from the Lippincott textbook, and this is transcultural and social aspects of nutrition. So let's rock and roll, shall we? So there are lots of factors that influence food preparation and the way we eat, our culture, our ethnicity, religion. And every client is unique. So never assume something just because they seem to be a certain ethnic group. Never make assumptions. You know what happens when you do that. Different regions develop different eating patterns, probably because of the availability of certain foods. And then a lot of areas have had the influence of fast food, McDonald's, and other types of restaurant chains rather, that have made changes that, we now see McDonald's everywhere in the world. And now even grocery stores are offering different types of ethnic foods that weren't always available before. So, what is culture? Culture it affects the way we think, the way we feel, the way we act, the way we eat. And when we're sick, food preference is important. And so as nurses, we should know to integrate ethnic and religious preferences whenever we can. Sometimes patients will refuse to eat hospital food, and it's delicious. But if that happens, you want to get a dietary consult, if they're in the hospital, and try to figure out, a way around it. And dietary changes are happening in the younger generations. And as different people, different generations are coming up, we're seeing different eating habits that are emerging. We're going to talk about how ethnicity and certain types of foods can affect our health. So, for example, for cultures that don't take in dairy products or milk, they might have bone disorders. If they take in a lot of salt, hypertension, heart disease. High calorie intake, overweight and obesity. Lots of fried foods and fatty foods, atherosclerosis, gallbladder disease, and obesity. And when we overcook vegetables, you'll lose the vitamins in them. You cook the vitamins right out. High sugar intake, dental caries, which are cavities, diabetes, obesity, nutrient deficiencies. But people often find comfort in their traditional foods, especially when they're sick. And they may insist on following cultural or even religious, dictates when they're sick. So food that's provided in a hospital or in a facility just might be unacceptable because of whatever their religion or their culture may be. True or false, the nurse should caution the client about cooking certain vegetables for too long, as it leads to a decrease in the amount of fat-soluble vitamins in the food. Is that true or false? That's false. It's water-soluble vitamins. You can cook the vitamins out of them, not fat soluble. So people of European origin, we have Anglo-European American, Anglo-Saxon, and your garden variety white American. Diet is influenced mostly from the British. There's, they say French, Greek, Spanish, Italian, German, and Russian. But for the white Anglo-Saxons, it's mostly from England. But I will say this, here in this country, we consume excess amounts of simple sugars, fried foods, and calories. And that leads to what's going on right now. Obesity, hypertension, diabetes is running rampant. African origin, when we talk about the West Indian and Caribbean areas, Africa and, some regions there, the food prep emphasizes practices in the southeastern United States, which is kind of high fat, high sodium, high sugar, not enough calcium or vitamin D or potassium, which leads to hypertension, heart disease, obesity, etc. They say that Latinos or Hispanic origin people believe that foods were hot or cold, and that you need a balance. Mexico, variety of beans, steamed rice, corn products, chili peppers, a lot of spices. Diets high in fiber and starch, not a lot of calcium, not a lot of iron and vitamins. Caribbean, and that differs. It depends on where in the Caribbean you are. It could be from the Spanish, from Native Americans, the British, the French, the Dutch, right? Eating patterns are based on where that person came from. Cuba, mostly Spanish influence, rice and beans. Puerto Rico, steamed white rice, beans, eggs, wheat. A lot of beer, malt beer is considered nutritious. And also they say that, some foods are considered hot or sour, right? East and Southeast Asia, a lot of rice, a lot of high fat animal protein, low fiber, high levels of saturated fats. Again, cardiac disease, hypertension, diabetes. China, It varies by the geographic region, but overall, the yin and the yang, where, they have to have kind of complementary dishes, low in fat, high in starch, stir frying and steaming, high in fiber, low in fat and protein, and they use a lot of herbs. Japan, love the sushi. They eat a lot of vegetables, fish and rice, sea vegetables, seafood. It's a very good diet, actually, the Japanese diet. And they have a lot of people that live past 100. Korea, kind of like Japanese or Chinese, lots of garlic and ginseng. The Philippines, are they Spanish or are they Asian? Kind of a combination of both. A lot of rice. Southeast Asia, again, differs, depends on specifically where you're from, like Cambodia versus Vietnam and Laos. But, lots of rice and fish and soybean products. India is a real mishmash because they're very diverse with their religion. There can be Hindus, Islamic people, Buddhists, Jainism, Sikhism, Zoroastrianism, Christianity, Judaism. If they're Hindu, they're usually vegan, right? And if Judaism, they need kosher food. Lots of different diverse people in India. The Middle East, lots of vegetables and legumes, no pork. Native American depends on where they're from. Hate to generalize. Is this true or false? The nurse should remember the basics of each type of culture to understand how each client views eating food to ensure they get the food that they need. The nurse should take the time to ask the client what they believe that they should be eating. You have to follow their guidelines when you can, but you can't just assume like everybody's Hindu and they all eat the same way, or everybody that's Jewish eats the same way. With Jews, there are kosher Jews, Orthodox Jews, and then not so. So again, you have to talk to your patient and find out exactly what they believe. So when we talk about Jewish individuals, this is important. And this is stuff that you'll need to know for the boards. So when their food is cooked for Orthodox Jews, separate dishes, pans, and silverware to prepare and serve meat and dairy foods, but no meat and dairy in the same meal. And if it's kosher prepared meal and it's wrapped, do not unwrap it because now it's no longer kosher if you touch it. And there's a way that they slaughter the animals that they eat. There's a kind of ritual that's got to be done. And no pork. They can only eat mammals that have split hooves and that chew their cud. In other words, cows, goats, and sheep. They cannot eat pigs, pork, rabbits, shellfish, sea creatures without fins and scales like octopus, eel, and squid, and scavenger fish. They are not allowed to eat. And the food has to be cooked ahead of time for the Sabbath, sundown Friday to sundown Saturday. They have days of fasting, but if they're an older person and they're really sick, the rabbi can excuse them. Church of Jesus Christ of the Latter-day Saints, the Mormons, no stimulants, no nicotine, no caffeine, and no alcohol. They are trying to preserve their bodies in the best possible health, and they don't eat a lot of meat. Catholics, no meat on Fridays, especially during Lent, the Lenten season, which is around Easter time, Ash Wednesday and Good Friday, days of fast. And when you get communion, you really should not be eating or drinking 1 hour before. And I was taught 1 hour after, but okay. Seventh-day Adventists, again, no stimulants, no pork, no shellfish, no alcohol. A lot of their practices are similar to Judaism, like their Sabbath day is Saturday, just like the Jews. But they as far as meals, a lot of them are vegan or vegetarian, but not all. Hindu. They believe all life forms are sacred because they might be the reincarnation of an ancestor. So that pig or that cow over there could be one of my aunts. So, and the cow especially is a sacred animal. So most of them are vegetarian. They don't use alcohol. They do drink coffee, tea, and chocolate. Islam, Muslims, alcoholic beverages are a no-no. Pork is an absolute no-no. Ramadan is 1 month a year, and that's fasting from dawn until after dark. And they eat foods like honey, dates, milk, meat, seafoods, and olive oil, but no pork. when we talk about vegetarian diets, there are different types, okay? And people become vegetarian or vegan for different reasons: religious, ethnic, ecological, economic, philosophical, or ethical reasons. Everybody's different. So a vegan is a strict vegetarian, no animal products, nothing. Lacto-vegetarian, plant foods, right? And dairy products, but no eggs. Ovo-vegetarians, plant food and eggs, but no dairy. And lacto-ovo-vegetarians, they'll eat plants and dairy and eggs. Got it? What are the benefits? Well, typically lower coronary artery disease, hypertension, usually type 2 diabetes rates can be low. But the problem is that cookies and sweets and simple sugars are vegan. They're not made with animals. So sometimes vegetarians eat too many of those. So, you have to kind of be careful. Sometimes there are social practices or factors that can influence the way we eat. So, if you're having taking care of patients in the hospital, talk with the client. Let clients eat together if that works. Encourage family members to come at mealtime. Do different things that help them feel a little more comfortable with eating. Emotional factors. There are lots of nationalities or ethnicities. I'm Italian. I eat when I'm happy. I eat when I'm sad. Right. So, but for some people, if they're sad, they won't eat. Or if they're happy, they can't eat. So, there are lots of different, you have to speak to your patient to find out exactly where they're coming from. As far as social determinants of health, economy, economic conditions, having enough money to eat, right? So if you have a client that says, I have to decide whether I eat or take my meds, you need a social worker in there to help them. And then if it's a physical problem, like they don't have teeth, they're edentulous, no teeth, or they have dentures, but they don't fit right, or they have dysphagia, which is difficulty swallowing, or they need diet modifications because of a disease process. Those are all things that could impact someone's diet. So what will a vegan diet include? And it's only vegetables, right? A true vegan will only eat vegetables. And that's the end. So that was a quick one, okay? So until next time, see you. Stop my share, and away we go.